Well, I'm David Stockwell, the Medical Center Director here at VA Northern California, and Happy New Year 2021. There have been so many comments this last year about I can't wait until 2020 is over. Well, we made it to the finish line in 2020, and it was a pretty long, challenging year at times. But I thought, let's just take a moment and review back some of the positive accomplishments of things that we've done here at our healthcare system during 2020. So I made a little list right here, and I just thought, let me share some musings about what all we've done in 2020 here at VA Northern California. The first is, did you know that last month we were the 7th largest VA in the country in terms of patients treated? So we've been hovering around the 10th largest in the country, 11th largest in the country for quite some time. But in the midst of COVID and challenges and moving forward and stopping and then going forward again and virtual care, we actually saw more patients than any medical center west of the Mississippi River last month, and the 7th busiest VA in the country. And so quite an accomplishment that we're able to meet the needs of the veterans in such a dramatic way. We saw meaningful improvement this last time that they shared the SAIL metrics. Those are the qualitative metrics that the VA uses to compare itself to other VAs and to the private sector as far as quality of care that we're delivering to patients. In fact, in Hospital Compare, we were better than the private sector on all but one measure during the latest data set. But in the SAIL measures, we improved meaningful improvement on 2/3 of all of the SAIL metrics during 2020. Lowering readmission rates into the hospital, lowering hospital-acquired infection rates, doing a better job as far as ambulatory care, sensitive conditions, and the treatment of patients. We made significant qualitative improvements in how we go about delivering health care during 2020. So congratulations on not only delivering care to veterans, improving the quality of the care that we're delivering to our veteran patients. We did 43,933 video visits this last fiscal year. We did 2,600 the year before. So it's a 1,500% increase in the total volume of video visits. So that's lowering the amount of times a veteran has to get in their car and drive to the VA, or how far they might have to go to drive to see the specialist. It keeps our staff safe during a pandemic, and it's a new modality of delivering care moving forward into the future that we're going to continue to use for our patients. And so congratulations on a massive increase in the volume of video visits this last year. We started the Hospital in Home program. That program allows patients to discharge from the hospital sooner than they otherwise would. It lowers their readmission rates. It improves their success in transitioning from their acute care stay to whatever their chronic disease or future state and treatment plan suggests for them. We made a dramatic difference with the Hospital in Home program. We also started the Home Care Coordination Program in 2020. That's the short-term, home-based primary care program that has robust, multi-times-a-week visits to patients post their hospital stay. It is already showing improvement in lowering readmission rates, improving outcomes for patients when they're discharged from the hospital. We didn't offer that until 2020. In fact, today we have 27 patients that are getting care in home care coordination. So congratulations to our healthcare team on both of those two new programs that we've started up in the last year. We grew our home-based primary care program by over 200 patients in 2020, and we grew our home telehealth program by about 200 patients as well. So getting our care closer to the veteran's home and providing that care in the patient's home, we've made dramatic progress during 2020. We opened the new research building in Martinez in 2020. So it's a long time coming to get additional research space and opportunities, and that brand new building that we celebrated and opened during 2020. We learned new phrases at our healthcare system like, can you believe we didn't know what social distancing was at the start of last fiscal year. But we know what it is today, and we've got stickers everywhere to remind us whether we're in the elevator, we're waiting in a line somewhere here at the medical center, whether we're in the cafeteria or in the break room. And we've been able to, during this year, have tremendous flexibility to change our behaviors, to wear masks to work every day. Can you imagine a year ago if we thought everybody was going to be masked coming to work and during their workday for the majority of the year? But we've adapted, we've accommodated to those changes, and we've continued to thrive in moving forward and providing care to veterans. Our responses to the fires this last summer, if you can remember back to last summer and the fires, the really poor air quality that we experienced across our whole healthcare system, our ability to deploy HEPA filters, to put dampeners on intake air exchanges for buildings that we're in, to reach out to all patients affected that have evacuation orders for their zip code, to make sure that they've got their prosthetic devices, that they've got their prescriptions, that they've got their home oxygen. If they have any healthcare needs, can we connect with them? Using our social workers to meet some of those non-healthcare but life-concerning issues that veterans had during the fire. Our healthcare team did a robust and dramatic response. We even had some new veterans enroll and sign up to get VA healthcare because we went to an evacuation center and they saw the level of care we were providing to other veteran patients in those settings. So tremendous effort on the response to the fires and the poor air quality this summer. We did that as a healthcare system, and you should be proud for those accomplishments during 2020. Our healthcare system rose above the 90% level in patient trust in the VA. So there's a question that says, I trust the VA for my healthcare needs. And this summer, for the first time, our medical center crested the 90% strongly agree positive response to that question from our veteran patients. So not only are we accomplishing new things, improving our qualitative metrics, the patients that get care here are responding and saying, wow, there may have been several issues with the VA in the past, but I have grown to trust the VA to meet my healthcare needs. More than 90% strongly agreed with that statement this summer. We actually increased the volume in some of our healthcare. Did you know that sleep studies, many of those are done in the patient's home, so the whole idea of restrictions during a pandemic, but we actually did 3,000 more sleep studies in 2020 than we did in 2019. So even in the midst of routine care shutting down and pandemics and virtual care, we actually grew the footprint of care we're provided in some of our specialty areas, including sleep studies this year. So that's a short list of things that we've actually positively accomplished during 2020. Yes, it's been an arduous year. Yes, it's been a challenging year. It's been a year that's required flexibility. It's been a year that's added some stress into our jobs and in our reality and to our entire lives as we've been struggling during this pandemic. But we've accomplished a lot. There's a lot to be proud of. And so, Happy New Year. We're concluding 2020, we're entering 2021, and I have great hopes for what we're going to accomplish next year as well. So thanks so much. Thanks for serving veterans, and I'll see you next year.